it doesn't mean that you're going to pass soon, but it means that you're to the point where you could need help with bathing. You could have an aide come into your house. You could have a hospice nurse, available whenever you needed it. But to go on hospice, the person has to be at the point, and I think this is what you're saying, that you wouldn't want any further aggressive treatment for your cancer.
That's true.
That you would want not more aggressive treatment to try to prolong your life as long as you possibly could. But hospice means you're at the point where you want to be kept comfortable and comfort measures, but no more aggressive chemo or anything like that.
Yeah, that's right.
And
I
if,
don't think my body would take it.
yeah,
We thought we'd try home health first to see if before we go to hospice.
yeah, okay,
But we're kind of uncertain if she can handle OT and PT.
Yeah.
So that's kind of what home health is, right?
yeah, and see, and just knowing it, just looking at your chart and knowing your history and reading Dr. Breyer's notes there with your metastatic breast cancer and where you're at. I mean, you could try physical therapy, but I'm not sure that's going to help you that much. It might wear you out a little bit.
It's, we've actually had a physical therapist in the home for the past couple of days, and
Do you think that,
he says I could do this, and this, and this, and I can't.
yeah, okay. So if you're not gonna do physical therapy, which I think is reasonable, I mean, so versus say you had just broken your hip and you didn't have this metastatic breast cancer and you expected, you had a lot of this reserve you have to do physical therapy, that would be a different thing. So the difference between home health care and hospice is mainly the physical therapy. And if you're not gonna do physical therapy, if you needed more help in the house, what hospice would allow for an aide to come into your house, usually 3 times a week or whatever you need.
Which we have that too.
Are you doing that yet?
Mm-hmm.
Yeah.
And so for home health care, the Medicare benefit only allows the aide for a short time, versus hospice, it's ongoing. And then the hospice, you'd have a hospice nurse, and you'd have a hospice nurse available 24 hours a day. So if we feel like you don't need physical therapy, or if you feel like you don't want to do physical therapy or try that, there's really not a whole lot of difference between hospice care and home health care, other than the hospice allows you to have more ongoing care.
Okay.
So you could do one of two things. You could just stay on home health care and switch over to hospice later. Or in your case, if we're not going to do physical therapy, you could start hospice now.
I think we'll try physical therapy.
You want to try that?
Don't you think, Anna Lou?
Yeah. I don't have the strength.
What could she do occupational still? OT instead of PT?
Yeah, she could do that. I mean, I'm not sure how much that's going to help.
Well, I guess one concern that I have is, and it would be helpful to have some guidance, is maybe how to attach extra handholds in the bathroom so that she can go. We need some more handholds for her.
Yeah.
I'll take care of that.
Well,
Well,
but let's find out what there is first. Do you have any ideas, or should we just ask the OT?
Yeah, we could have an occupational therapy do a safety evaluation in your
Okay,
house and stuff.
that would be great. That
Yeah.
would be really helpful.
And then as time goes on, if you want and you need more help than home health care is doing, we could switch you over to hospice, which would actually give you a little more help.
okay.
Would you want to do that? Because you're the boss,
Yeah.
Or if you want to go straight to hospice, we could do that and still have an occupational therapist come in and do a safety evaluation too.
Okay. Now, if I did no more physical therapy, then no one would come in and say, you need to walk with a walker.
Yeah,
Right.
that's the physical therapist.
Okay.
And it sounds like you don't want that, right?
My feet won't do that.
Right.
I don't know at this point where I've had the cancer for so many years and that my body is basically worn down from it, I don't know that it would make any sense.
The help that we have right now is we have a woman come in for 2 hours every morning, gets her up, prepares breakfast,
And this is someone you've hired.
This is
Yeah,
someone.
and that seems